The idea of temporomandibular joint disorder is the articular disc. There is a disc that relates to the condyle of the mandible. And it moves with the condyle of the mandible on the articular meatus. So right here, you have the condyle of the mandible. So the idea is that you're going to have the disc right there. And when you open and close your mouth, the disc goes over the articular eminence, that upside down mountain. So go ahead and open your mouth wider. So it went over and closed. So do you notice it goes over that eminence?
Yes.
Okay, and it translates the mandible forward and back. So what happens sometimes in temporomandibular joint disorders, the disc can get stuck and it can get your jaw open, lock open or lock close. And the lateral pterygoid, there are discussions in the anatomy field. The superior division of the lateral pterygoid tends to attach onto the articular disc, also besides on the joint capsule. Not on everybody, that's why there's discussions in the books of a back and forth. Clicking does not mean temporomandibular joint disorders. The idea of ringing in the ear, tinnitus, headaches, all this is created by the temporomandibular joint. So the temporalis and the masseter and the medial pterygoid work as the masticatory muscles, as I was saying. And the lateral pterygoid, you're going to have a superior and a inferior division, and they are going to deviate them out from side to side. So temporomandibular joint and the cervical spine. So 1 second here. I just want you to notice how the temporomandibular joint is so close to the atlanto-occipital joint. So the temporomandibular and the atlanto-occipital are close and in a close relationship. Remember, the infrahyoid, suprahyoid muscles and infrahyoid muscles are going to attach to the hyoid bone and the mandible and the clavicle and the sternum. So we're going to have to communicate with them. The goal here is to touch the muscles. There's portions of the muscles that I couldn't touch. And so the medial pterygoid is under the tongue, and then the lateral pterygoid is up behind the upper teeth. And so both of them, your tongue and my fingers, your tongue gonna fight with my fingers. Okay? And then you're gonna make a sensation of gagging sometimes. But the masseter, no. The masseter, my thumb, is gonna go on the outside of your teeth, the molar, and way high, looking for a trigger point that talks to your ear, talks to the medial part, okay? So that's what I'm gonna be doing right now, okay? This is the masseter, bite tight for me. See how the muscle is talking to me? So I'm not gliding inside of the mouth because of the skin is sensitive. This is tender right there, you feel that? And then open a little bit more, and right here, there, oh, that's the most I'm gonna go. Is that okay or is that too much?
That's okay.
But it is tender the heck, isn't it? There, and you feel here, there. Surprisingly, right? You're doing great. Buccinator is the muscle that does blow. We work on it before, just to the outside. Right here tends to be tender. Is it tender? The buccinator a little bit, okay? Very gentle. And the buccinator attaches to some of the muscles of the esophagus. If I do detailed work inside the mouth, the masseter, the work I just did, is the most common. So now I'm gonna go ahead and have him opening the mouth. Go ahead and open your mouth. And there is the lateral pterygoid. You can really be onto that upside down mountain here, okay? And that is for the lateral pterygoid. And go ahead and gently close. And then I'm gonna bring your head facing down a little bit more now. So we loosen, go mylohyoid, okay? So, which is part of the suprahyoid. So I'm using the middle finger and the index, okay? And I'm hooking. Now I'm gonna bring this up, hooking that towards the medial pterygoid. Ooh, tender right there. Okay? Is it making you salivate? The salivary gland is here. Okay? You okay?